That was perfect timing, I guess.
Yes, perfect timing.
Mo, you gonna do the honors?
Yes. Welcome everyone to the discussion. This is episode 10. We're going to be discussing health disparities in the African American community. We have two wonderful guests this evening. I'm going to let them introduce themselves. First, I'm going to start with Gerard. What's up, buddy? How you feeling?
We're doing great, man. Happy to finally be back, man. We had a bit of a hiatus, but it's good to be back, man.
Yes, sir. Yes, sir. Yes, sir. So first, I want to start with Kiana Trabue. Please introduce yourself and tell people about you.
Sure. Thank you both for inviting me to be here this evening. I'm excited about the conversation. So I'm Kiana Trabue. I currently serve as Executive Director of Population Health Strategies at the Health Collaborative. I lead our Population and Community Health Initiative across the region, which is called Gen H. Our work is really focused around the topic that we're going to be discussing tonight around health disparities and how do we reduce health disparities across our region, and specifically around addressing the social determinants of health that often have the most impact on an individual's health outcomes. So like I said, I'm really excited to have the conversation and really even more excited to share the stage with Ryan tonight.
Speaking of Ryan, go right ahead, Ryan. Tell us about yourself.
Hey, everybody. Happy Friday. My name is Ryan Adcock. I'm the executive director of an organization called Cradle Cincinnati, which is a partnership of dozens of organizations and hundreds of people here in Cincinnati trying to reduce what has been a really high and tragic infant mortality rate in our community for a long time now. And one of the reasons that I think you guys invited me to this particular topic is the rate at which infants die in our community has an incredible disparity in it, and unfortunately is connected to race in some very deep ways, and not connected to things like class and other assumptions that folks might make. So eager to dig in on some of that, and also always delighted to join the stage with Kiana. And when I heard she was going to be on, it was an easy yes.
Yeah, so I was very strategic about that. So great. Gerard, I'm unmute you there and have you take over, buddy.
Absolutely. Thanks again to both of you all for agreeing to join. I want to start with you, Kiana, and I want you to kind of speak to how you feel the coronavirus, COVID, is affecting the African American community and kind of some things that we can do to combat that.
Sure, very timely question. So I think we've all seen some of the data that shows us that the African American population is being hit by the coronavirus at a disproportionate rate than other races. So whether that's through just being diagnosed, but then also death rates and hospitalizations, the rates are higher amongst African Americans across our community. Unfortunately, I think that's due to a lot of factors. I talked about social determinants of health. So things like where people live, whether they have adequate housing, whether they're living in poverty, a lot of the essential workers, as they call them, grocery stores, janitorial services, retail, things like that. Oftentimes those individuals that are in those positions are people of color and Black people, unfortunately. And so they've been forced to work through this pandemic. They don't have the luxury of being able to work from home or to take vacation time or take sick time and not work. I think part of it is that. The other piece is underlying health conditions. So we know when we talk about health disparities, Ryan touched on infant mortality in particular, but we also see health disparities in the Black community around other diseases and conditions like diabetes and heart disease, cancers, all of those things, COPD, all of those things are underlying health conditions that make it worse when you are infected with a virus like COVID-19. And so that's one of the reasons why we see there's also historical mistrust of the healthcare system for a lot of valid reasons. People don't trust the healthcare system. They don't trust doctors. They don't trust their providers. They don't trust the information that's coming out because oftentimes they, from their families, they've heard stories of family members not being treated appropriately. We know that oftentimes Black patients are not listened to. They're not believed when they say that they are experiencing pain and things like that. So I think that there are a lot of things at play. It's the social and economic conditions in which our communities have been forced to live in. It's also implicit bias and racism in our healthcare system that are causing a lot of these disparities and the mistrust that we're seeing.
Thank you for that. Thank you for that. A quick follow-up question. What can people do, right, who are in these compromised positions? What are some resources that they may have available to them that they're unaware of to kind of help them through this trying time?
What I see in our community is oftentimes messages that are not coming from our healthcare systems in particular, but community-based organizations that have built those relationships and have that trust in those specific neighborhoods. I believe that's the place where people can go to get that information. Sometimes it's not about the message, it's about the messenger. So I would call on community-based organizations that have been leading this work, that have been working specifically in those neighborhoods, but then also thinking about those of us who do work in the public health and healthcare space that also happen to be from these neighborhoods or are a part of these populations. I see us having a responsibility of reaching out to those communities and to those populations to give them the message. So you have to go where the people are, take the messages where the people are, instead of always waiting for them to come to us to get the information.
Great point, Kiana. And that's part of the reason why we're doing this, to get messaging out. So thank you for bringing that up, Gerard.
Ryan, so what I want to do is I want to ask you a question in the same vein. With infant mortality, have you seen COVID impacted? And what I mean by that, has it increased in the African-American community since COVID has hit?
And I'm sorry to interrupt, and also, can you tell us a little bit about infant mortality rate as regards to African Americans in the Cincinnati region?
Yeah, absolutely. So infant mortality is the rate at which babies die before their first birthday. So babies who are born alive but die before their first birthday. And as recently as 2011, Hamilton County had the second worst infant mortality rate in the whole country. And that was driven by a disparity and a high rate of infant mortality in the African-American community specifically. Thankfully, that's starting to change. Our overall infant mortality rate has fallen since then. And we actually just announced last week that the Black infant mortality rate here in Hamilton County was the lowest it has ever been last year. So that's tremendous news. It's with a lot of effort from a lot of partners in our community. And it's quite honestly with moms and Black moms specifically leading the way on how we address this issue. So that's encouraging. We have a long, long way to go, though. We still have rates that are far too high. So long story short, what it really means is that too many babies are born far too soon here, far too early, far too small, and don't make it to their first birthday. So we are very, very interested in the question of how is COVID-19 going to impact pregnancy, how is it going to impact infant deaths, and as you all know, pregnancy is 9 months along, and so we're here 4 months into this crisis, and we have not, thankfully, seen rates of infant death go up or rates of preterm birth go up yet. We, in fact, have been measuring those specifically in the Black community and have not seen those rates go up yet. But I say yet because we anticipate that that might change. We know that COVID-19 is not directly killing a lot of babies, but we do know that it is leading to highly, highly stressful situations for almost every family in our region. And we know that stress can lead to poor pregnancy outcomes. So we think that may just take a while to hit here. We're certainly hopeful that it won't change outcomes. And there's lots of things we have in place where we're trying to support families and wrap around them, specifically around stress. But we're keeping a close eye on all of the local data so that if it does start to change, we can start to make that part of the way that the community is addressing this.
Ryan, what are some of the things that Black moms can do to maybe alleviate stress? What are some tips that you provide them in order to kind of decrease the chances of infant mortality?
Yeah, in general, the answer to stress, the best answer to stress that science knows about is community. And so what we've tried to do is form communities all over the city. Even during this time, we have a lot of digital communities that have been developed. And so there's a part of our work called Queen's Village, which is led by Black women, for Black women. And you can learn all about Queen's Village by going to blackwomenforthewin.com and learn how to plug in, find your community, find small groups that you might be able to meet with online, literally find a one-on-one friend who might walk you through some of these things, connect to resources around stress reduction and mental health. We've had online activities like yoga, and if you have little kids, dance parties with the kids, and just things that will de-stress folks. We try to be very intentional about asking people what it is that they want before we try to develop solutions for them. And what moms told us, especially early on in this crisis, was a couple things. One, they're feeling stress and missing the community that they have. And two, they are, when in the case where they have little kids, just trying to look for something to keep their kids entertained, right? So we've had lots of digital interactions designed for young families. You can find all those by searching for Cradle Cincinnati on YouTube, and really at this point a whole host of good resources that are both sort of in the stress reduction category and community building category, but also we've got some resources on there where local doctors are answering the questions of moms about COVID-19 and its impact on pregnancy. So we really wanted to be able to link families to high quality information about this emerging disease.
Got you, Gerard. Here we.
All right, great. Thank you. Thank you both for that. So I kind of want to get into a little bit of some relationship questions, right? And what I mean by that is Ryan and Kiana. Kiana, when I spoke with Ryan earlier, he was ecstatic. He was just ecstatic that you was going to be on as well. So how do you two know each other, and is there a working relationship in play here within the health industry for you two?
Yeah, absolutely. In a number of ways. So I mentioned earlier, my role with the Health Collaborative is to lead our region's population and community health initiative. And so we do utilize what's called the collective impact model to do that work, which is also the model that Ryan and Cradle Cincinnati uses. So we've been connected through that work over the past 3 years. And I've spent some time serving on Cradle Cincinnati's advisory board as well, and have been able to help see how this work has improved, see how they've grown, understanding how, Queens Village was developed. It's been really great to see Ryan in particular learn and grow in his role leading this work and coming to this understanding around what the data is telling us. And the data was saying that Black babies are dying. And so while we do care about all babies, one of the things that Ryan says is we need to focus on Black babies right now because they're the ones that are dying. So we've had a working relationship and a partnership for quite some time. I'm really supportive of his work and him as an individual. But then also I look at him now as really a standard around how to truly do equity-centered work. He talked about Queens Village, and he talked about, it's Black women led. Who better to lead this work than Black women? And so I'm learning a lot from him just by watching the work that he's doing in the spaces that he's been creating for, voices that oftentimes have not had a seat at the table.
Uh-oh. Sorry.
Ryan, as a white male, how did you come to a place where you were learning or where you grew to be so well or to do so well in equity-centered work?
Yeah, well, first of all, Kiana, thank you. That means a lot, and your mentorship of me has meant a lot over the years, for sure. It's a great question, and I would say it's a journey that I'm still on. And I think for anybody out there who is a white guy who's wanting to get into the equity space or do better in whatever role they're in, it probably starts with as much humility as you can absolutely bring to the table. And what I mean by that is recognizing that not everyone's life experience is the same. And I would say that in the community that I grew up in here in town, which was largely white, in the school I went to that was largely white, I'm not sure as a young kid I really learned that lesson that not everyone has the same exact experience as you do. And so in my working life, have tried very, very hard to listen first, ask a lot of questions, and then perhaps lead with my own responses. But that careful listening and that really trying to put yourself in the other person's shoes that you're with And I'll tell you what, it's not infrequent in my work that my knee-jerk reaction to someone whose life experience who's been different from mine is one of disagreement. I think, oh, that's not necessarily how I might do that. But what I've learned is that disagreement isn't the same as me being right. So, so I try very carefully to, take a step back and consider it from a variety of angles. And I'll tell you what, when we're leading work where we are trying to engage specifically Black women, I'm obviously not Black nor a woman. And so, learning lessons the hard way early on, that my voice just is not powerful in every room. And there are rooms where it is powerful, and there's rooms where I can gain resources for communities. There's rooms where I can advocate for communities. There's rooms where a white guy in a suit and tie can get the job done, right? But there's other rooms where my voice is not going to be the one that changes minds. And so I need to surround myself with people who have relational capital in those communities and can make a difference. And so that recognition that even though somebody who looks like me is often somebody who is considered to have a lot of power, I'm actually pretty powerless when it comes to a lot of the work that we're trying to do. So I need to find smart, brilliant people who I can put around me and who can hold that kind of power.
I like what you said about finding smart, brilliant people and who can hold that power. I think it takes a strong individual to recognize that you don't always have to be the smartest person in the room. So kudos to you for that, man, for sure. You spoke about advocacy work, right? And sometimes how a white man in a suit can get the job done. In the health industry, right, what does your advocacy work look like?
Yeah, I think recently, in the past couple of years, it has looked like having the hard conversations about racism. And when 2 years ago, we worked with 450 members of the community to develop a new strategic plan for infant mortality in our region. And when we did that, overwhelmingly, the thing that community members told us was they felt like they did not get equal treatment within the healthcare setting. Mm-hmm. And I think that humility I talked about when we're talking with healthcare leaders is, whether you believe that is true or not, whether you think your behavior is racist or not, you need to have the humility to pause and say there's an overwhelming sentiment that Black folks are not being treated equally within healthcare settings. And so what that might mean in some cases is you need to stop egregious behavior of racism. What it might mean in other cases is you need to go out of your way to welcome Black folks into that setting, to make them feel heard, to make them feel seen, and starting those conversations at the very highest levels around healthcare settings. Last year, Cradle Cincinnati helped to design and implement implicit bias trainings for all of the women's health centers here in town, and more than 300 healthcare professionals went through that. Sometimes was hard, sometimes was challenging, but I think the journey that I'm hoping healthcare is on is one where, as a collection of individuals, we're willing to not be offended by the fact that somebody might think they experienced racism within our walls, but instead just have this sort of continuous improvement mindset. Okay, we need to do better. How do we get better? Who can help us get better? How do we better amplify those voices? And so it's a lot of that advocacy. The other place where we try to do a lot of advocacy is within the walls of political offices and within the state legislature. And there are laws and rules and ways of doing things that we've done for decades, or in some cases centuries, where we think tweaks to those laws, in some cases big changes to those laws, can make a difference. So we have worked hard to advocate for new infant mortality legislation, for example, as well.
Mm-hmm.
Hey, thank you for that, Ryan. Kiana, you actually spoke to mistrust in the healthcare industry a little bit earlier. I know for a fact that I've had friends and even family members who have said, like, when they have Medicaid, the doctors don't treat them well, or whatever the case may be. Can you kind of speak a little bit more to some of the experiences that may have been shared with you from some people that you've come into contact with?
Yeah, absolutely. And before I get into that, I do want to piggyback on something Ryan talked about with, with providing that implicit bias training to the women's centers at each of the hospitals in our region. And I will be remiss if I didn't give a shout out to Dr. Nicole Avant and Avant Consulting Group, who facilitated those trainings. And I know that was really difficult, but they're an amazing group of intellectuals that they know what they're doing. They know how to handle challenging conversations. And so for those of you that are listening, if you're looking for an organization that can come in and do those trainings and facilitate some of those tough conversations around race, they're the group to do it. But I can speak from my own experience, specific to being a mom and being pregnant and feeling like I was having some complications and going to my doctor and not being heard and not being listened to. And, I've also heard in some of the communities that we work in through Gen H around people going to the doctor and being in pain and doctors not wanting to give them pain medication because the assumption is that they are drug addicts or that they're drug dealers. So there are a lot of things that I've heard happen, unfortunately. And as Ryan said, part of it is, as an individual, as a provider, whether you believe that to be true or not, perception is reality for a lot of folks. And if people feel that way, that is ultimately going to impact, number one, how they access the healthcare system, whether they access it or not. I know some people that forego going to the doctor because of bad experiences that they've had with their providers. So it impacts the individual's ability to access the healthcare system to begin with. And then that ultimately has an impact on their overall health outcomes. So if I'm diabetic and I go see my provider and I'm not treated well and I don't feel like I'm being heard or being respected, if I don't go back, where does that leave my condition? And so eventually I end up with uncontrollable diabetes, which ends up leaving me in the hospital, going to the emergency room for something that I could have handled with my primary care physician. But again, because of that mistrust, I'm not comfortable going there.
So you spoke about the training, as have Ryan. How is it measured? Like, what are the metrics to determine whether or not the treatment is getting better? Are there surveys? What are your thoughts?
Yeah, I can't speak to that specifically around those trainings that Ryan helped bring to the systems. I do know that with Nicole Avant and Avant Consulting Group, for sure, there are some baseline surveys that are taken prior to training and then assessing the knowledge after the trainings. But I don't know if Ryan has anything more specific to add to that.
Yeah, I think what I would add is some stuff that's on our radar for the future. So there's a vision we have that we're going to start to try to unroll over the course of this year, which is to standardize one question across healthcare settings, starting within prenatal care settings and labor and deliverance settings, which is, do you feel like you were treated with respect today? And just trying to make that a question that becomes the culture of healthcare, and figuring out ways to allow families to anonymously answer that question. We're thinking through, technology solutions through that. There's lots of ways to get there. But we think that concept of respect is pretty central to this issue, and could be a way of helping to get there. There's also researchers in town who are currently working with individual healthcare settings to try to measure the existing interaction with clients and change with that over time. I think, unfortunately, we are at the very, very beginning of these conversations. So it really right now is all about starting the conversation, all about not being afraid of the word racism, all about just getting folks ready to dive in. I think that is more true right now than it's ever been. I certainly hope it is. And so we think that there's a big opportunity coming this year.
All right, great. And I have a question from someone who on the Facebook Live. The question is for you, Ryan. How has prenatal care and the birthing process changed due to COVID-19, if you're aware? And how is Cradle responding to these policies and providing support for these new moms?
That's great. In some pretty big ways. So I will point to the best answer for that is if you go to YouTube and search for Cradle Cincinnati. We've got a couple different OBGYNs locally who are answering that question pretty much in depth. But I'll tell you the state of things today, and that is that still frequently at many of the birthing centers, you're asked to go with no more than one individual by your side. So my wife and I just had a baby pre-COVID about 9 months ago, and we had our whole crew there, right? There were, I don't know, close to a dozen people there. And, you know, my mom drove to the hospital at 4 a.m. and sat there with us and all kinds of stuff. So that's not the state of things right now. And I'll tell you, there's an important instance to point out specifically, which is there are families who want both their partner there and their doula there. And that's a situation that's been hard to navigate right now. And there's a lot of doulas who are getting creative about technology-based interactions and other kinds of solutions. But that's one major way that it's changed, is who's allowed in the hospital setting. Obviously, if mom is COVID positive, which is rare but has happened here locally, there's a whole number of ways that it changes. And again, we've got some physicians who are answering questions around things like best practices around breastfeeding. The national OBGYN centers have really zeroed on the best way to care for COVID patients specifically. But I think I would be remiss if I did not point out that even though it can feel scary, the hospital is a pretty safe place to be in the midst of COVID-19. The hospital systems are systems that are, of course, run by physicians, have infectious disease experts built into them, and are really doing a good job of keeping those systems clean. And we do not think that folks are getting COVID-19 within hospital systems. So early on, I know especially that was a big fear of a lot of families. And boy, being pregnant and whether you are mom or dad in that situation, it's a stressful time, and it's more stressful than ever right now. So if you or someone you know who is pregnant right now, I would encourage you to reach out to us through cradlecincinnati.org, through the Queens Village Facebook page, a whole bunch of ways to do it. And we've got resources, individuals who can walk by your side, help make sure your questions get answered, et cetera.
Hey, so congratulations on the baby, boy or girl?
Little girl. We have a 3-year-old boy, and now we've got a little 9-month-old girl. Yeah. Are you done? We're I don't know if I'm ready to publicly say that. We're maybe not done. No, we're maybe not done is what I'll say.
I'm gonna hold back. I'm sorry. What's and real quick, and this is just for me. What's a doula? What's a doula?
Yeah. So a doula is a great resource. There's a bunch of good doulas in Cincinnati that really can help. I mean, as I think about it, really help de-stress the pregnancy experience, and specifically the labor and delivery experience. So sort of what they're classically known for is advocating for moms within the labor and delivery experience. If a mom knows that she is going to try to do everything to avoid a C-section, as one example, then boy, she probably doesn't want one more thing on her mind as she's trying to deliver, where a doula can come in and sort of help advocate for the wishes and needs of mom. They're trained to support in a whole wide variety of ways throughout that labor and delivery process. What I'm personally really excited about, and what we've got some partnerships coming in the future, is really thinking about the prenatal side of doula care, and how do doulas fit in with other great folks in our community, like community health workers or home visitors, who are supporting moms before they deliver and trying to make that part of their experience as unstressful as possible.
All right, thank you for that, Ryan. Kiana, I want to come back to you. You've mentioned Gen H a few times. I was wondering if you could give us a little bit more information about that and the work you all do.
Sure, absolutely. And before I get into that, just one thing, you had asked a question about, how do we know some of these trainings and other things are working? And I think the ultimate measure is, are the health outcomes improving? That's the ultimate goal, right? Is to have those health outcomes improve. And so that's the ultimate measure. How do we look at the data to see, are we making a difference? Are we seeing, a reduction in disparities? If not, then we know we have some more work to do. So whether that means continuing the work we started or trying something different. So that's the ultimate measure. So I'll tell you a little bit about the Health Collaborative as an organization. We're a nonprofit organization based here in Cincinnati. We work to bring together pretty much anybody that has a vested interest in improving health and healthcare across the region. We are a membership-based organization, so all of the major health systems in our region, the 6 major health systems in our region, are members of our organization. We work alongside them and work on their behalf to try and solve some of healthcare's most challenging problems. What that looks like is different based on exactly who we're working with and what kind of project we're working on. We also serve as a health information exchange. So we provide the infrastructure for clinical data across our entire region, and also do some data analytics and really, again, try to help our health systems identify what some of those biggest challenges are, and then come up with solutions for them. Specifically around Gen H, that's really the community-facing work of our organization. Our work right now is really focused on addressing the individual health-related social needs, and then also more systemic social determinants of health. So what does that look like? One of the things that we have been testing out is a new model of care within clinical settings, where we're actually asking Medicare and Medicaid beneficiaries questions about their social needs while they're in the hospital or while they're in that community health center. So that, what that looks like is through a screening tool. So we're asking them questions about housing. We're asking them questions about their food. Do you need food? Do you feel like you run out of food before you have enough money to get more? Do you have transportation needs? Do you have utilities needs? Are you experiencing violence? From there, once we have screened those individuals and identified what those needs are, we're working to connect them to resources to help them address those needs. And in many cases, we're also connecting those individuals to a patient navigator or a community health worker who can work right alongside them and get them connected to the resources they need to help them address those identified health-related social needs or social determinants of health. This is a new model that we're testing out. We're one of about 27 communities across the country that received some funding to test out this new model. It's really the first time that the federal government has put any funding towards addressing these social determinants of health in a formal way. And really what we're trying to look at is, if we address these social needs, how does this impact, number one, the health outcomes? Number two, how does it impact the total cost of their healthcare? And number three, how does it impact the way that they're accessing the healthcare system? So it's been really interesting working with our hospitals on this model. We've been collecting a lot of data. So far, what the data is telling us is that overwhelmingly, majority of the people have issues with food insecurity, housing, and transportation. So from there, we utilize the data we're collecting through that model to think about, okay, so it sounds like what the data is telling us is we need to be focused around addressing transportation issues, food insecurity, and housing. We don't do that alone. Partnerships are critical to this work. Oftentimes we work alongside another organization, support the work that they're doing, try to bring the health voice and the health lens to that work. One example of that is our partnership with the Greater Cincinnati Regional Food Policy Council. We've recently begun partnering with them to try and think about ways that our health system and hospital members can support that work. Trying to take inventory of what things are already happening. We know that some of the hospitals have food pantries located right inside the hospital so that patients can have access to food while they're there. So we've been trying to take inventory of those things that are already happening across the community, and then also thinking about where the gaps are and trying to bring additional resources to the table in order to push that work forward.
You know, when I hear you talk about that, Kiana, I think about just how broken our narrative around health is in this country. I mean, I think we tend to think exercise plus a good diet equals health, right? And it's really more like exercise plus a good diet plus access to transportation plus enough money to put the right kinds of food on the table plus good housing plus, you know, on and on and on. And it turns out that something like the quality of housing you live in actually matters much, much more than some of the other things that we traditionally associate with health. So it makes the challenge of you, the challenge of me, the challenge of hospital system leaders pretty hard, because all of a sudden everything is health. I mean, all of it, and that's what makes it really exciting work, but it's also what makes it really challenging work.
Yeah, it's really interesting. I was recently looking at some data from Health Policy Institute of Ohio, who recently put out their 2019 Ohio Health Value Dashboard. Right. And it's really comparing the state of Ohio against all the other 49 states. And unfortunately, Ohio ranks 46th out of 50 states in health value. And when they broke down that data and started looking at it, a lot of it is attributed to the fact that we don't invest upstream. We don't focus on prevention. we don't spend our dollars on those things that matter. There's a stat that I quote all the time that only 20% of an individual's overall health status, we can only contribute about 20% to clinical care. So that means all the stuff that happens in a hospital and all the stuff that happens in a doctor's office, but that remaining 80% that makes up an individual's overall health status comes from genetics, which we unfortunately can't do anything about, but then also those social and economic conditions in which people live. So if you are someone who lives in poverty and you don't have access to adequate transportation, you might be living in public housing, you might not have a well-paying job, all of those things will ultimately have the most impact on whether or not you have the opportunity to be healthy. And I know you've seen that, Ryan, also with infant mortality. You talked a little bit about that at the beginning of the call, is that when you, even when you account for education, you know, people can have the same level of education, the same income level. Unfortunately, it really doesn't make that much of a difference.
Yeah, the thing I often say that's true here locally, it's also true nationally, is upper middle class Black woman with a master's degree tends to have worse pregnancy outcomes than a white mom who never graduated from high school. So that needs to get us out of this narrative that it's all socioeconomic status. And if Black moms just had more resources, they would be just fine. And it needs us, it forces us to start saying, okay, racism is part of the issue here. Right. There are clearly social factors at play here if you can get rid of socioeconomic status and not solve the problem.
Right.
Yeah. Something I wanted to mention, I'll unmute you here in a second, Trabue. But something I wanted to mention, we talk the opioid epidemic, right? And there's a lot of questions as to why the opioid epidemic has not hit the African American community as hard as middle class white American. I think one of the themes that I've been hearing is that it's because African Americans are typically under prescribed opioids. That if there's in pain or something, we talk about this health equity. Can you speak to that a little bit, Kiana and Ryan?
Yeah, just a little bit, and you touched on it right there. When you start thinking about the opioid epidemic and how it started, particularly here in the state of Ohio, was really around prescribing habits. And so looking at how often and who was getting prescriptions for opioids, and how that has contributed to folks transitioning from those prescription medications to street drugs. And it goes back to my earlier point. If you are an individual, if you're a Black person that is in pain and you go to your doctor and your doctor tells you that they don't believe you, that you're in pain, or they underprescribe pain medication for you, that will absolutely contribute to it. So it's one of those situations where it's horrible that people are being profiled that way and that racism is at play, but it also becomes a protective factor in a sense, because if they had wrote those prescriptions, then we would see more Black folks that were being hit by this opioid epidemic.
And and unfortunately, that's breaking news. I don't think many people that I know wouldn't know that information. So thank you for highlighting that. Ryan, got anything to add to that?
What it makes me think of, which is a little bit different, but I'll tell you what, I go around the city and the state talking about infant mortality all the time. I have had the frequent experience of giving a 45-minute presentation on infant mortality and racial disparity, and I won't mention drug use once. And there's a reason I don't. It's actually not closely tied to infant mortality, which surprises some people. I don't mention it for good reason. It's not a big part of it. And the hand goes up when I'm done, and the first question I get is, are all these moms on drugs? And what is buried in that question, which is usually well-intended, is just the darkest things and the darkest sort of judgments that we bring. And I think it's implicit in many cases. But exactly. These biases of, I heard it was Black moms, and I think I'm going to just make some assumptions that I've been taught to make. And beyond drugs, I also hear teen pregnancy. Again, teen pregnancy not terribly associated with infant mortality, but folks are just assuming, these are 15-year-old moms who are all on drugs, and that must be the issue, which is, for some people, a safer narrative than, systemic racism is the issue, and we really need to upend systems if we want to solve this. It's a much sort of cleaner narrative, if you're a white person at least, to say, oh, well, we just need to do a say no to drugs campaign and that'll solve it.
Right.
Yeah,
well, thank
really
you.
just,
I'm sorry. Go ahead.
Absolves people of responsibility and accountability. That's what it does.
Yeah. So thank you for mentioning that as well, Ryan, because that I think is also breaking news for some people. So, Gerard?
I just want to say the little session where Ryan and Kiana was feeding. I can understand how you two work so well together. That was golden. So I appreciate all the information that came out of that for sure. I want to go back to something that you mentioned earlier, Kiana, in regards to transportation, food insecurity, and housing being some determining factors that impacted health. We can understand how food insecurity would impact it. And to some degree, I can understand how transportation, you can't get here and there, right? But with housing, I know there's lead, right? But what other ways is housing impacting your health?
So I think the first thing that comes to mind is really relevant to where we are today with the COVID pandemic. So as an example, if you are an individual who lives in public housing or you live in a very densely populated area, whether that's your neighborhood or your particular apartment building, when one person is infected with the COVID-19 virus and don't know it, and they're coming in and out of those spaces, then that increases your risk for developing that disease. Another thing, you talked about lead. I think people understand how that impacts health. One other thing that people don't necessarily always think about is air quality. So what's the quality of air like in your neighborhood? And does that contribute to your development of asthma, or does that exacerbate asthma if you already have been diagnosed with asthma? Cincinnati Children's has done a number of studies in the community of Avondale with kids with asthma and looking at their emergency room usage. And in fact, what they found was what worked better for them than any medication or any treatment was moving individuals out of their current housing. Once some of those kids moved into new housing, they didn't have asthma attacks. They weren't coming to the emergency room as often. So that's just a couple of examples.
I would maybe add to that stress. So Hamilton County has 40,000 too few affordable housing units, 40,000, which means there are just thousands upon thousands of families out there who are trying to make it work, who are trying to make the system that's been designed to house them work for them, and it's just not working, which means that eviction is far too common. And you think about stressful life events, again, in the space where I work during pregnancy. Imagine if you are already dealing with the stress of pregnancy, already dealing with other stressors in your life, and you're getting upended out of your house, right? So that kind of stress we think is really important. And I'd be remiss if I didn't plug the fact that we partner with Strategies to End Homelessness to try to solve that for pregnant women specifically. So if you know somebody who is pregnant and struggling with housing, please go to cradlecincinnati.org, reach out to us. We've got some unique solutions for pregnant women in Hamilton County specifically.
Yes. So great plug for Strategies to End Homelessness. We had Kevin on. Kevin, if you're watching, we appreciate you. Check out that episode on our website. Also, I want to mention, we talked about eviction. Janice Jones, I see you tuned in on Facebook. So shout out to you as well. Those two have great resources. So thank you, Gerard.
Yeah, for sure. So when I listen to you all talk about housing, I think a lot about the politics, right? How affordable housing we don't have enough units, or how people are being gentrified, whatever those cases may be. Ryan, you also mentioned being an advocate in the health spaces. Is there any way that you typically tie those two together? What does advocacy in politics look like for health spaces, Ryan?
Yeah, I think it's a good question. The thing that first comes to mind, it goes way back to what I said about trying to be a good listener, and that's one of my roles. And so I would say early on in my work, I thought, man, housing is an awfully big issue, and I get that it's connected to health outcomes, but I don't know if I can solve it. And mom after mom after mom after mom just said the biggest stressor in my life is housing. So we've tried to plug in with folks like Janice Jones since then and really involve ourselves, not become the housing experts or the housing agency in town, but really have those folks help inform our work and try to develop solutions for pregnant women specifically. I'll tell you what, Kiana's mentioned this concept of social determinants of health a couple times, the notion that social factors lead to health outcomes. That's a place where advocacy and politics is still necessary. I would say it's a not atypical scenario for either Kiana or I to have a conversation with an elected leader who really wants health to be about stethoscopes and blood pressure machines and access to care, which is important. We hear a lot about access to care. That is important. But when you start to think about, if the state of Ohio wants to improve from that, 46th or 47th in the country, we really need better affordable housing solutions. We really need better transportation systems. We really need better public health infrastructure. That is still a challenge for elected leaders sometimes who are, trying to solve lots and lots of issues and are not necessarily always appreciative of your making it more complicated. And so I think that collectively, as people around the state, around the community, are advocating for a variety of issues, the more we can make these linkages for elected officials, I think the better. The more that we can talk about housing as a health issue, the more we can talk about transportation as a health issue.
Go ahead, Kiana, I'm sorry.
No, I was just going to agree with Ryan and say, making sure that there are individuals in the room that can speak to the health impacts of a lot of these things is critically important. It is challenging unless you happen to be an elected official and a public health professional, which I am. So I think that gives me a little bit of leg up when I'm talking to some of these folks.
Yes. An elected official. Tell us about your elected official status, please.
Yeah, so I currently serve as a council member in the village of Woodlawn, Ohio. So I was actually appointed to council in 2018, in the fall of 2018 to finish out someone's unexpired term. And then I ran my first campaign in the fall of 2019 and was sworn in for a 4-year term this past January of 2020. So it's been a really interesting journey, being able to look at this through, look at politics and policy through this public health lens. It's been really interesting, but I think it's definitely important to have that person in the room that can speak both languages in a lot of different ways. And I think the more evidence that we can show and the more best practices we can bring to the table around how our policies oftentimes exacerbate some of the health disparities that we see, then I think we'll be in a better place. I know that we've seen a lot come out here locally and across the country, across the state, where county commissioners, city councils, public health departments are declaring racism a public health crisis. We saw that come out for the Hamilton County Commissioners. I believe they're going to be voting on this declaration next week, which is great. But the most important part is, what are we going to do about it? And how do we start to engage local leaders to try to address some of these things? And how do we put the dollars behind it to support this work as well? Oftentimes we identify a problem, we all come together and say it's a problem, but when it comes time to putting the resources towards it, then we fall short. So I'm really, really hopeful that we're starting to see this, and this conversation is happening more widely. And I'm really interested in the necessary actions it's going to take to really address some of these issues.
It's such a powerful time to be calling racism what it is, which is a public health crisis, because we're all experiencing what it means to see a public health crisis up close.
Right.
And, I think as we think about what has our nation's response been to COVID-19, how many resources have we put into it? How much have we stopped life? How many fundamental changes have we made because of a public health crisis? Right. That if we start to think of racism through that lens too, then all of a sudden it feels more doable. Oh, we are capable of making enormous changes. We are capable of investing trillions of dollars on a dime when there's a public health crisis, and this is one.
Right. Absolutely.
Thank you for adding that, Ryan. I just have a quick question. You talked about food insecurity, and I recall when Mayor Cranley and other council members, when they broke ground on the Avondale Town Center and said, we're going to have a grocery store in there. I recall the time where Aldi was a grocery store in the Avondale Town Center. The people of Avondale were able to go to Aldi and get groceries. They didn't have to go to Kennard or Coreyville or many of these other places. When you look at the transportation system it's not as easy to get to those places, particularly if you're a single mom with children and so on and so forth. So my question to you, food deserts. If you could speak a little bit about food deserts, because we look in our area. You know, you got Walnut Hills. Look at some of these places that really don't have. They have a large population of people who do not have access to quality foods. If you can speak a little bit about that, start with you, Kiana.
Sure. So you're taking me back to my days when I worked for Hamilton County Public Health some years ago, and we were talking about food deserts, and that was nearly 10 years ago, and we're still talking about food deserts. Unfortunately, when we think about poverty, we think about particular neighborhoods. We get a specific connotation in our head when we think about poverty. And then when we layer that with the racial and ethnic makeup of our communities, we see that the food deserts are oftentimes located in areas where we have more minority populations. When you start talking about grocery stores, unfortunately, grocery stores are a business. Their business model is to make a profit, to make revenue. And so when they come into spaces and they're not making a revenue, I think the easy thing to say is that the community is not supporting that particular store, or the community is not buying the particular products. And so they pull out. It's a really interesting position to be in. And again, it's more about those social determinants. So if people don't have adequate transportation to get to a grocery store, how can they go? If they're working a low wage job, or if they've lost their job, or if they are receiving, SNAP benefits, but those benefits run out before the end of the month and they don't have more to get food, how are they going to come and serve your grocery store? And so we do see a lot of food deserts in greater Cincinnati and across those neighborhoods. And I think we could probably all name what they are. You just named a couple: Avondale, Walnut Hills. And it's just really unfortunate because it's a huge barrier for people that are trying to live healthier lifestyles. So you have your, everybody's telling you to eat healthy, to be healthy, but if you don't have a place to go get healthy food, how are you going to do that? So it's a huge problem, and it's been a problem for a really long time. There are a lot of food pantries out there and other organizations that are trying to make it easier to get healthy food in the hands of these individuals. But we really need grocery stores in neighborhoods that people can access, that are going to carry the kind of product that people want to buy and can buy, and the type of product that people actually know how to prepare, because that's another issue.
Certainly. Ryan?
Yeah, I think we need to start to see access to food as a public good. And so I think it's very easy to just sort of say, well, Kroger shouldn't have moved out. But to Kiana's point, Kroger's trying to do what businesses try to do, which is make money. I think there's a public policy opportunity here. So Cincinnati invented the concept of a public fire department. About 150 years ago, fire departments were private, and they were just trying to make money. And what that meant was that if you didn't have fire insurance, where you paid the fire department every month, then they wouldn't come put the fire out in your house, right? And that turned out to be a really bad idea. And it led to all sorts of enormous fires and big problems. And there was a huge fire down on Central Parkway about where Coffee Emporium is today, that spread all throughout, much of over the Rhine, and killed people. And the city said, man, there's got to be a better way. Not having large fires is in the public interest. And so they literally started the first public fire department here. I think that opportunity exists now around food access. And can we say, man, it is in the public good that people have access to fresh, healthy food? So what does it look like? What does that mean? Does that mean that in Toledo, for example, a hospital system up there has started a grocery store that's a not-for-profit grocery store attached to a hospital system, and their point is we are a health facility and fresh, healthy food is necessary for health. And so I think there's lots of creative solutions out there, and I think actually this is a really good time for creative solutions. I think just about everybody in the country is looking for new kinds of grocery stores as the old model feels a little strange right now. Yeah.
And no, thank you for bringing that up. And I something that I learned as well is like the city they provide. And I don't know if it's directly the city or whom it is, but like for instance, Saks Fifth Avenue downtown, they don't make a profit, but I know I've learned that the city gives them a subsidy to keep them down there so that they stay down there. And as you, to the point you make, could it be that, you know, our city officials provide subsidies to grocery stores to have a grocery store in Avondale? In fact, I don't know if that was the case before, but you know, I think there's a social responsibility thing there as well, not just about, you know, simply making a profit. So thank you about that, Ryan. Gerard?
So we have a little less than 10 minutes, right? And we discussed a wide ranging topics: policy, transportation, social determinants. What tips do you all have? Ryan, you mentioned earlier just trying to eliminate stress in regards.
Uh-oh. Unmute 1 second. Go ahead. Sorry, Gerard.
All right, no problem. For people who are in compromising situations, Kiana, I really loved what you said about people such as myself, people such as Maurice, actually going to the people, right? Being customer-facing people, so to speak, for lack of better terms. What can we do to more so educate people, to get out there and actually assist people? That's one question. And also, what can they do to try to overcome these barriers again? What type of food can they eat, maybe that they're not eating or are not aware of?
Yeah. Do you want me to start?
Yes, Ryan disconnected from the call. I'm waiting for him to jump back on.
Oh, okay. Yeah, so I think the important thing is one of the things that Ryan mentioned earlier is to listen. So listen to people, be willing to listen to people, to understand where they're coming from, to listen to them from a place of empathy and trying to put yourself in their shoes. I also think that, you know, going where the people are, not, again, always expecting them to come to us, but meeting people where they are and taking the time to understand what their circumstances are. I also think that it's really important as individuals to understand that you have control over your health and that you don't have to put, you know, those outcomes in other people's hands. Speak up. I talked a lot about, you know, the mistrust of the healthcare system, and so people decide not to go. I would encourage people to continue to go and make sure that your voice is heard. You know, continue to ask questions until you get those questions answered. There's always a champion, there's always an advocate in that space. And so doing a little bit of work and trying to figure out who that advocate is, whether that's someone else that works in that healthcare space, or whether that's a doula or a community health worker. Sometimes it's a family member or a friend. I'll share something here that I'm sure my sister won't mind me sharing, but my sister is a breast cancer survivor. She was 37 years old when she was diagnosed with stage 3 breast cancer. And I remember, you know, hearing that from her and deciding in that moment that I was going to be her healthcare advocate. So I was going to be that one that was going to ask the hard questions, that was going to push back on treatment options, all of those things, because again, that stress of being that person that's just been diagnosed with cancer, you're not necessarily in the headspace to be asking those questions or to be thinking about those things. You just want to get well. So I would say, you know, find that trusted individual that can go alongside you and go with you to ask those tough questions and to advocate on your behalf is definitely the way. In addition to that, I think that people have to take control over their own lives and decide, you know, what works best for them and their family. You know, what I say is a healthy food, quote unquote, for you may not be accessible to you, but what is something small? What's a small change that you can make until you can get there?
1 second. I'm sorry. Yeah, we lost Ryan.
Okay, so I think that was my final question, the last thing that I wanted to leave with. I do want to shout out Mo, who has taken it upon himself to open up his own gym in his basement nonetheless. But, you know, Mo been doing his thing. So because exercising right is another way to stay healthy. Sorry. So that's preventive maintenance. So kudos to you, Mo. Kiana, I'm going to give you the last word. Do you have anything else that you want to share that maybe we didn't talk about today?
Please.
So I just want to reiterate, you know, something that Ryan talked about this as it related to pregnancy and childbirth, and just saying, you know, the hospitals are open, they are safe, they are taking every measure to make sure that they are reducing individuals' risk of getting infected with the COVID-19 virus. So please don't shy away. If you're feeling sick, reach out to your providers, go to your primary care physician. Don't wait until you're feeling so sick that you have to go to the emergency room. They are safe. The providers are there and they're ready to serve you. So I just want to make sure that people are not, you know, foregoing any of medical care because they're afraid they're going to get infected with COVID at the hospital. That's one thing. The other thing is to continue to advocate for yourself. As I mentioned before, ask questions about your healthcare, be involved in the healthcare process, talk to your friends and family so that you can find a provider. If you go to a provider and you don't feel comfortable, that's fine. There's 500 other ones right down the street that you can try out. Go until you find someone that you are comfortable with, that you can be honest and transparent with, and that you feel is going to give you the best care possible. Because if not, your life literally depends on it.
Certainly, certainly. Thank you, thank you, thank you. Anything
Welcome.
else? We greatly appreciate it. Anything else you want to add, Gerard?
I just want to say thank you, Kiana. One, I did not know you were an elected public official, so kudos to you. Let us know if there's ever anything that we can do to support you offline. If there's ever anything, we would love to just continue ongoing support for you. I can easily tell that you are a strong advocate of us, so I really appreciate that. Thank you. Absolutely. Other than that, other than thanking you, thanking Ryan and the work that you all are doing as far as collaboration, I really appreciate it. That's it, Momo. Good to be back with you, brother.
Yes, sir. Yes, sir. Yes, sir.
Hey, before I leave,
yes,
Black Lives Matter.
Black Lives Matter. Black Lives Matter.
Absolutely.
And our lives can't matter unless Black Lives matter. So
absolutely.
So,
absolutely. Thank you for that, Kiana.
Yes, yes. So that's all we got this evening. Kiana, I echo the same sentiment that Gerard did. Thank you so much for joining us. I watch everything you do. You're definitely an inspiration to me and many others. I appreciate you informing us about proper ways to take care of ourselves and how to advocate for our health. So thank you again for that. Looking forward to have you again because I got some other things in mind. Gerard and myself are going to have some discussions about other ways we can keep you, get you involved as well. Because I kind of like this platform to be able to discuss the many different things that affect our communities.
Awesome.
Without having to, pay for it or anything like that. So thank you for taking the time, your Friday night, because I'm sure you could be doing something else, but taking your time this evening to speak with us. Unfortunately, we did lose Ryan, but he was on for most of the call, and I'm sure Ryan will. We appreciate Ryan as well and the great work that he's done to help decrease infant mortality here in our region. So thank you all. Thank you all. Look forward to us next week. We got a special treat. Not going to disclose it yet, but look for us next Friday, okay? Thank you all. Thank you all. Thank you all. You have a great evening.
Good night.
Good night.